All right, so we have Ronaldo here. We can actually see that he's actually missing. He's missing a tooth. He's missing his lateral incisor. So as a dentist, what I think about doing is making space to have that tooth replaced there. So it's either stuck inside his jaw, and what we can do is use braces to pull it down, or it may be just missing from birth and we can put an implant in there or something like that after we make the space. Because at the moment, he looks a little bit funny with that because his eye tooth is more closer to the center of his face than it should be. Boom. Look at him now. What a stud. So it looks like he's got some porcelain veneers done. They've made the space and they've probably put an implant in there, or they've done a bridge to cover up that space. You can see that that's looking really nice. The color's looking great. The shape of the teeth are looking fairly good. I'd much prefer the teeth to sort of go with his bottom lip and actually follow the lip. But overall, that's a really, really good transformation. I'll give that a 9 out of 10. All right, here's Tom Cruise. Pretty good looking guy. Didn't start off that way. You can see that from this photo, a couple of his central incisors are a bit funny. They're a bit discolored. They're sort of pointing outwards. So not in an ideal position, and the color's not that great either. Boom. Tom Cruise. Looking good, buddy. Now, Tom Cruise is a really tricky one because the problem with him is that he's got a midline shift. If you look at his face, the middle of his face and the middle of his teeth, they don't match. They're sort of like that. So no matter what you do, no matter how nice your teeth are, he's always going to look a bit funny. There's many reasons for this. It's probably just the way his jaws develop. He's probably got a little bit of a cant, because you can see that on this side, you can see a lot of his gums, but on the other side, you can't really see too much of the gums. But overall, the color's looking pretty good now. I'd give that a 7 out of 10. Probably add another 2 points for difficulty because correcting that midline is really, really tricky.